In health news tonight, a woman who lost her sight, but thanks to a very dedicated surgeon who simply would not give up on this, she got it back again. And Karen, this doctor really was breaking new ground.
He really was. So the patient needed cornea transplant. Donated corneas hadn't worked in the past for her, so she was really stuck. So the surgeon went looking for an alternative, and what he found has actually never been used here in Alberta before.
Almost 20/40, which is fantastic. Yeah, so we gotta take a look though, just to be sure.
20/40 is good enough to drive. It's amazing eyesight for Shauna Lyons, who over the years has gone almost blind.
I could see the light and dark. As far as earlier in the stage, I was able to make outline of people, shadows, but at the end of it, I couldn't see anything.
Lyons has an inherited disorder called ectodermal dysplasia. It can affect development in a variety of ways. In Lyons' case, she was born with a cleft palate, and it's affected her hearing and sight. Lyons has had 3 corneal transplants. Each failed. But Dr. Al Ghul wasn't ready to give up. He wanted to try a synthetic cornea.
It is highly technical. It does require a lot of care. But in these cases, if we know that there's a good chance that the rest of the eye is healthy, there could be a significant benefit to the patient in providing this technology.
I figured it couldn't hurt. I would try anything. Try anything to try and get my eyesight back.
The doctor flew to Boston to learn how to implant the cornea, called a Boston Kpro. He convinced Alberta Health Services to pay for it and implanted the cornea in Lyons' left eye. It worked.
To somehow have the honor to help them in bringing back some normality to their life by seeing better, it's truly humbling, and I love my job for that.
I see everything. And when I first got my eyesight, it was just awesome compared to not seeing nothing. First thing I think I did was go on FaceTime with my daughter so I could see her.
That's so great. So has she had both eyes done or just one?
Only one. She can only get one done. The other eye does not work at all.
Okay, so this surgeon, this is the first time this has been done in Alberta. Will it now become more common?
A little bit, probably not a lot. Here's the thing, it's about 3 times more expensive. The surgery is much more difficult, not really appropriate for a lot of patients, and a lot of patients do really, really well with the donated corneas. But it is interesting to note her daughter has inherited the same disorder, so this experience with her mom may help her daughter down the road.
Might work for her too.
Yeah.
Okay, Karen, thank you.